They've travelled halfway around the world to learn about one of the best health systems, coming to Christchurch to hear more.
The main reason we're here is because New Zealand have been identified as a good best practice site internationally for how care is well integrated across the whole system. So hospitals, community, GPs talking together very well. So the delegation here from Karta is really just here to learn how to do that better, make sure everything's well connected for patients.
Nicola is working within a team of Karta delegates to get some tips on how to improve their country's health organisation. Back in 2006, the country changed its National Healthcare Authority, establishing the Supreme Council of Health. And now they're seeing firsthand what other developed nations like New Zealand, Canada and the UK do, and what they can take back to the Middle East.
They all have those themes in common, that they've got well-developed healthcare, not just in hospitals, but within primary care settings and GP centres, so they have a broader range of health provision.
Karta has been developing new health strategies over the past few years, and it's taken time to develop it here too.
I think it's our size and our cooperation. So what you'll find in Canterbury is unique for the rest of the country too, actually. So it stands out not just nationally, but also not internationally, but nationally as well. So it's a cooperation, years of clinicians working across the system, realising that actually better care can get delivered to patients by working more closely together, realising that hospitals are really important places, but that most healthcare is delivered in the community.
And Vince believes there's a good reason for that.
The elements of what we deliver here is used in the rest of the country, and in fact, to be fair, lots of what we've got here we've borrowed and stealed from the rest of the country, so we don't think for a minute that this is all about Canterbury being particularly special and having invented it here. We've adapted things from internationally and also from locally and from our national colleagues.
However, Nicola says it takes time to get it right.
New Zealanders can feel quite lucky, I think. I'm British, and I know many people in Britain would complain about their healthcare system, as people here in New Zealand, I'm sure, will complain about their healthcare system. It's a difficult business to get right. But from what we see back in Karta in the Middle East, where really there is very little provision, even in a country that's very rich and very ambitious, it has a long way to go to get all these services in place. So it's a good reminder, I think, to be very grateful for good healthcare.
And it isn't the first country to visit this health centre.
But this is not unusual for us in Canterbury now. Last year we had visitors from Norway, Switzerland, the UK, Australia, America, Singapore. So lots of people are coming here, and we're sharing lots of ideas. And we do go and present around the country, so around the world. So we were in Brussels last year and over in the Netherlands. And again, as I say, this is always a two-way street. We can give a lot of information, but we're really important for us to understand what's going on in their health jurisdictions.
The Karta representatives are not only getting information about the system, but gathering ideas from other departments.
We have a delegation here of healthcare professionals from Karta who work with ambulance services, GP centres, hospitals. So they're going to be meeting colleagues here in New Zealand. So our ambulance team will be meeting with your ambulance team, and our GPs will be meeting with your GPs, and our hospital staff seeing your hospital staff. So when we go back to the Middle East and back to Karta, we can have a good debate about what everybody's seen and put the whole jigsaw puzzle together.
The delegates plan to have talks about fundraising this type of system today, heading back to Karta in the next few days to produce a proposal.
The next step there is formally we need to produce a written plan and a written strategy, which will become the new policy for healthcare in Karta. So that's important. But more importantly, I think it's the messages that our staff will take back on the ground.
Structure is really important, but the key ingredient and the key message for us back to our friends from Qatar is about relationships, building strong relationships across the system, not just in hospitals and not just in primary care.
New Zealand representatives are set to travel to their Northern Hemispheric friends in June, keeping the strong relationship in good health. Jared McCulloch, CTV News.